Just, are you able to give a bit of an overview of palliative care, end of life, hospice, hospital, how all of that might flow as if things progress?
Yeah. So I guess sadly for some patients with cancer, at some point the treatments that we're giving to control the cancer either stop working or start to create problems that are so severe that the benefit of the treatment is outweighed by the problems that it's causing. And that is always, I guess that's a part of our role, is to try and help support that timing of decision making. So that transition is a bit different, I guess, for everyone, depending on what their wishes are. So to give an example, for instance, if you were coming into a cancer care centre and you'd been receiving treatment and unfortunately your disease had progressed and the oncology team recommended that continuing the treatment was not in your best interests, that would be a point that would definitely link in with a community palliative care service who would then be able to bring that care to you. As if someone does wish to be at home toward the end of their life when their level of function is deteriorating and their level of symptoms are maybe escalating, we are quite reliant on families to be there to support them, and it's a very important role. For some people, they say, no, home is too hard. I don't have access to 3 family members at a time that I might be in bed for most of my care. So looking at where care could be provided if it couldn't be at home, and the options for that will vary depending on where people are located. So in Brisbane, there is some palliative care units provided within acute hospitals. So for instance, QE2, now PA, Royal Brisbane, and we have St Vincent's, which is a specialist palliative care unit. What we're helping with is identifying that time with you, because it's, obviously it's a decision to stop treatment is in conjunction with medical oncology. However, our treatment is always centred around the patient. So you might decide, for instance, that you don't want to continue treatment before your medical oncologist does, and they're the sorts of discussions that we can support. So then referring and linking with community services, providing the care within the home, and also providing access to hospice or inpatient palliative care units to help support end-of-life care. So that would be something that a specialist palliative care team would do.